What has been the reaction to the comments made by Prime Minister Boris Johnson on the 3rd of March relating to him shaking hands with many people?
Well, I think at the time it was entertaining. I don't think anyone thought very much of it, but it was playing, as it were, to the cheap seats, very much in the style of Trump, that trying to entertain people rather than think seriously. And this kind of reflects his immaturity as a politician. When you have a crisis like this, you have a very high probability of having reputational damage. And the best way to deal with it is to overreact. If it isn't as bad as you expected it to be, you look good. If it's as bad as expected to be, it looks good. He decided to go with making it a bit of a joke and having a laugh, which really hasn't played well with the public.
Professor, the World Health Organization is saying that they are facing a chronic shortage of COVID-19 equipment. How prepared is the NHS to handle the COVID-19 crisis?
Very unprepared. They've had about 10 years where they've been slimming them down, trying to make them more efficient. And in the process, they've let people go. They've closed hospitals. They have a massive labor shortage of nurses, shortage of doctors, at every single level. And, the idea was to save money. And they have saved money. But the problem is now it doesn't have the resilience to handle a big shock, a development of this scale that we are now experiencing with the COVID-19 crisis. So I think really, I'm not sure they can gear up in the short time. 10 years or slimming down cannot really be turned around in a few weeks or months.
When are the home test kits available? I'm hearing that they delivered antigen tests to the NHS workers today. Prior to that, NHS workers were only tested if they were sick like anyone else.
Yes, indeed. And I had a phone call with a couple of NHS doctors this afternoon. And these kits are supposed to be on the way. They haven't got any information on this. They believe that they've been delivered at some logistical center and they're being deep cleaned, but no one's actually seen any of these kits. So before they get around to distributing the kits, I think it'll be another week, which is a long time in this particular crisis. Janie, one of the things that people don't get is that once you've got the kits out there, it doesn't mean that we'll get the results back. Now, the kits have to go from the doctor's offices to a lab to be analyzed, and that's a logistical challenge. And then they've got a next challenge is the processing of the results, and that's going to take several days for them to get this going, to process 25,000 tests a day, which is their objective. Right now they're doing about 5,000 or 6,000 tests a week. Now, processing 25,000 is going to require lots of people, lots of manpower, lots of equipment, which aren't on the ground yet.
And looking at Google, 66.44 million people in the UK, so it's an extraordinary amount of people and, not that many tests being underway. In terms of the mood, Professor, how is it? It's normally a bustling city. It's now deserted. Are people adhering to the social distancing rules? And if not, what are the consequences?
Well, I think that what we see is an absence of people in the centre of London, as your video shows. But I live in a more residential area, and I can say that I was a bit surprised. I went to drop the garbage today, and I must have come across, about 500 meters from my house. I must have come across 50 people either jogging or out for a walk. So I'm not really seeing this isolation that we're supposed to be going. People are not taking that seriously. Now, one thing I'm really happy is that, this may sound perverse, but the fact that Prince Charles and Boris Johnson have it will create a sense of urgency amongst people who think, well, this isn't something that's going to affect me. But now that you've got these public figures getting it, it might sink in finally, I hope.
Well, I'm not sure if you're aware, but yes, big news in Australia and no doubt around the world is our beaches, in particular Bondi. Just a number of days ago, it was shut down due to the amount of people there, and more recently, a couple of beaches in Victoria. So people not really adhering to the social distancing rules. And a lot of people are also thinking that sunshine can kill the virus.
Yes, that is hilarious. I've heard about garlic, I've heard about boiling water, I've heard about saunas. That's another wonderful new theory coming up, which unfortunately everyone wishes it were true, but it sadly isn't.
Yes, absolutely. Thank you for clearing that up. And finally, Professor, we are seeing the best and the worst of people. It is great to see the generosity of so many companies donating bikes and cars to NHS workers to ensure they get to work safely. And also this week, the nation saying thank you for the selfless and tireless work that the health and social care staff do in the front line. London lighting up in blue. So we are seeing some good stuff around.
This is true, and I'm pleased for that. And everyone clapped the other night for all the NHS workers and so on. And I'm pleased that they're getting appreciated, but they are being overworked. They need protective equipment, which is in short supply. They need to be tested, and I think this amateur approach that the British government has taken thus far is going to cost lives. And fingers crossed, the NHS will be able to. The hardworking doctors of the hospital system will pull through.
Yes, well, they certainly are going to be doing a very amazing job, very selfless. Thank you so much, Professor Narula, for your time and your expertise. Do stay well, and thank you very much for joining us on Weekend Edition.
Thank you.